Hi everyone, it's Joan Neehall again. This series is a tribute to my professional colleagues who are identifying specific changes and reactions to this unusual chapter in our history. They also share tools for improving our lives as we move forward. By highlighting their work and my own current experience, my goal is to help everyone to move closer to their optimum state of happiness. Dr. Bregman is a psychiatrist out of Florida, and he identified the cave syndrome recently. And here's what he said at CNN News. I've seen patients who are locked in their room at home while conducting telemedicine calls and they're wearing a mask. The cave syndrome is a reluctance to engage in pre-pandemic activities that involve socializing, indoor dining, even returning to the workplace. Whether introverted or extroverted, something in between, social contact of some kind is important for our psychological well-being. The loss of spontaneity and our inability to make plans have left many in a state of grief. There's no closure. There seems to be no meaning to pandemic grief, pandemic loss, and above all, pandemic fatigue. When's the right time to emerge from our cave, from the safety of our homes? We have to make that decision for ourselves. It's based on our individual medical circumstances, family issues, and our work circumstances. If you find yourself or someone else feeling nervous about re-entry into social activities outside your home, you're not alone. Brené Brown has worked extensively on vulnerability. You may experience hesitation to re-engage in your pre-pandemic social life. A client of mine who is a medical doctor had difficulty saying no to her friends who would frequently invite her to attend social events. She really wanted to support them, enjoy their company, but felt guilt. In her home, she has a married daughter, son-in-law, and a baby grandchild living with her and her husband temporarily. She didn't want to risk the health of her family. She felt extra scrutiny because she's a doctor. Her father was in an extended care facility due to dementia, and her elderly mother was living alone. Dr. Alan Teo, an associate professor of psychiatry in Portland, suggests that some anxiety about rejoining is natural. We've all been through a very difficult time. Here's a simple experiment that one client engaged in to step outside of her cave. She agreed to do something good for someone else every day. On her walk, she would smile and engage in conversations with others whom she came across. Even masked, her eyes showed her smile, and she could see theirs. Another act of kindness was to help her elderly neighbors carry their groceries into the apartment building. She really made me laugh, telling me the story of feeding a parking meter to help avoid a ticket to an unknown motorist. As we step out of our cave in the service of others, we might be pleasantly surprised to notice a decrease in our anxiety and an increase in our happiness quotient. Dr. Bregman suggests that step one is to develop a positive attitude. A positive mindset allows you to believe that some good things can happen as you leave the house. But we all have a negativity bias. This is something we come by honestly because of our ancestors. They had to assess threats in the environment for survival. There could be a lion lurking nearby. Have you noticed how easy it is to fall into the negativity rabbit hole? An effective way to change that bias is to prime your brain to pay attention to the positive events in your life. Do this every day, and you may be surprised to notice your appreciation of life is enhanced. Another thing you might want to do is to practice the art of savoring. This means I'd like you to amplify a positive experience that you're having in the present. This could be a simple thing like having a cup of tea or going on a walk and sharing it with a friend. in order to relive those good feelings. You could even Instagram it. Our internal compass or GPS can seem to be out of whack when we have conflicting expert guidance and may be experiencing pandemic fatigue. Take a deep breath and acknowledge all those feelings. Make a list. Ask yourself, how have you dealt with similar feelings in the past? How can you use those skills today? How can you embrace these possibilities in the middle of ambiguity and grow stronger? Use your imagination to discover ways to be free, to exert your autonomy in small incremental steps. My recommendation: create a new routine with small attainable goals. You can experience a sense of control in your life once again when you do this every day. For the first time in our lives, we are experiencing collective interdependence. We're depending on each other. This quotation sums it up. Autonomy leads to engagement. How we make meaning out of the past year and a half is crucial to our mental health and the maintenance of our psychological immune system. My work outside of client sessions primarily revolves around the science of happiness. Let's bounce forward as we all cope with the rapid changes resulting from the global pandemic and further lockdowns. Please share this article with friends and loved ones who may benefit, and follow me here on Medium, Twitter, LinkedIn, and be well above all. Bye now.